CMS seeks a new direction for its Innovation Center, governors weigh in on the latest attempt to repeal Obamacare, and today's powerful pathogens are outrunning the pipeline of new antibiotics. Welcome to This Week in Managed Care. I'm Laura Jost. CMS wants consumers and competition to drive healthcare innovation, not the government. That's the message CMS Administrator Seema Verma sent this week in an op-ed in the Wall Street Journal, which came with a 9-page proposal to reshape the focus of the Center for Medicare and Medicaid Innovation. Known as the Innovation Center, this section of CMS was the hub for trying new payment models, including one for hip and knee replacements that is now being overhauled. HHS Secretary Dr. Tom Price was a critic of the Innovation Center as a member of Congress, and his desire to let physicians have more flexibility is seen in the new CMS proposal. The document draws on several guiding principles. Promote competition based on quality, outcomes, and cost. Focus on voluntary models and reduce unnecessary regulations. Empower patients, their families, and caregivers to take ownership of their care. Use data-driven insights to ensure cost-effective care that also improves outcomes. Draw on partnerships and collaborations for a transparent model design and evaluation, and test smaller-scale models that can be expanded. Wrote Verma, "We will move away from the assumption that Washington can engineer a more efficient healthcare system from afar, that we should specify the processes healthcare providers are required to follow." With time running out before Congress must pass a budget resolution, the Senate is the scene of one final try to use that maneuver to overturn the Affordable Care Act with 51 votes. But 11 governors, 5 Democrats, 5 Republicans, and 1 independent opposed the bill from Senators Bill Cassidy of Louisiana and Lindsey Graham of South Carolina. The state of Alaska may be critical, where independent Governor Bill Walker opposes the bill and may work to convince Senator Lisa Murkowski to continue her opposition to efforts to get rid of the ACA. The bill also faces opposition from the American Medical Association and the American Hospital Association. Wrote AMA CEO Dr. James Madara, "We sincerely urge the Senate to take short-term measures to stabilize the health insurance market by continuing to fund cost-sharing reduction payments." The World Health Organization says that the current pipeline of antibiotics in development won't be enough to fight the pathogens that are becoming resistant to available drugs. In a new report, the WHO cites the need for new antibiotics to fight the bacteria that causes tuberculosis and C. diff infection. Only 5 of the 32 new chemical antibiotics being developed against priority pathogens represent a new chemical class, and only 8 agents meet at least one of the 4 tests to be considered innovative. The Director General of the WHO said in a statement, "Antimicrobial resistance is a global health emergency that will seriously jeopardize progress in modern medicine. There is an urgent need for more investment in research and development for antibiotic-resistant infections, including TB. Otherwise, we will be forced back to a time when people feared common infections and risked their lives from minor surgery." Shingles is on the rise for no known reason, leading to a new recommendation that people age 50 and older be vaccinated to prevent the disease. The guidance from the American Academy of Ophthalmology and the American Dermatology Association lowers the recommended age for vaccination by 10 years. Shingles is a painful condition that consists of an itchy rash on the skin and the formation of blisters and scabs. Some patients have a disfiguring complication called herpes zoster, the same virus that causes the chickenpox, which can lead to blindness. 1 in 3 people are expected to develop shingles, mostly in their 50s. Said Dr. Elizabeth Cohen, "The number of people affected is growing and the health consequences are significant. The zoster vaccine is safe and effective. If you are older than 50 and are eligible, just do it." Finally, the American Journal of Managed Care reported last weekend from the U.S. Psychiatric and Mental Health Congress in New Orleans, where physicians learned about the benefits of Mideas, a new treatment for adult ADHD that lasts 16 hours, and attended sessions on treatment-resistant depression, opioid use, and the importance of social connections. Dr. Thomas Costin told AJMC that payers have helped drive progress in the fight against opioid abuse, but there is still some unwillingness to pay for abuse-deterrent formulations.
But yes, we have made tremendous improvements, and the insurance carriers deserve a good amount of credit for that. Unfortunately, the abuse-resistant formulations of opiates, which are been developed, generally cost substantially more than the non-abuse resistant, and there has been some real pushback from a variety of sources, the insurers being one of them, about paying for that, which is unfortunate because tamper-resistant, abuse-resistant, we've got plenty of evidence that that works very well to decrease the abuse of that specific drug. And there are, of course, dozens of opiates, and they would all have to have some type of intervention of this sort so that all the abusers wouldn't simply target the ones that don't have these. But right now, to have the financial factor dictating that we'll use the cheapest stuff, which is the most abusable, isn't good.
For full coverage of this year's Psych Congress, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Laura Jost. Thanks for joining us.